Hi, this is my presentation for our intervention strategy project. From our intake assessment video, here's a brief client overview and needs. Susan is a 55-year-old white non-Hispanic female. She resides with her husband, mother, who she takes care of, and two nieces, ages 10 and 14, that she now has guardianship over. She identifies as Christian, in particular Presbyterian. Her case needs include MAP classes, mental health counseling, and participating in nurturing parenting programs. SMART goals are needed to achieve the action items in the case plan. SMART goal stands for specific, measurable, achievable, relevant, and time-bound or based. Case Plan Action Item 1. Attend MAP classes and become registered as a foster parent. MAP classes. MAP stands for Model Approach to Partnerships in Parenting and is designed to equip potential foster parents to care for youth who have experienced maltreatment and abuse. Susan needs to become a licensed foster parent despite currently being a kinship placement in order to receive financial assistance and other supports to help the girls. MAP classes will also help her to recognize signs of trauma in the girls, aid in co-parenting, and aid with other issues like attachment and loss. From the Adoption and Foster Care site within Union County Human Services. SMART goal for MAP classes. Specific, Susan is to attend and complete the next scheduled MAP training in March 2026. Measurable, Susan will attend at least 9 of the 10 classes, perform a self-assessment, as well as social worker providing their own evaluation. Attainable, Susan will be able to complete the program and receive her licensure as a foster parent. Relevant, this aligns with her commitment to being a legal guardian to her nieces and better support them. Time-based, classes are once a week for 2 hours for a series of 10 sessions. In terms of measurable objectives, goal attainment and scaling is something the social worker can use to help track Susan's progress. It is person-centered and measures a client's goal progress using a 5-point scale from +2 to -2. +2 is much more than expected. +1 is somewhat more. 0 is the baseline or what's expected. -1 is somewhat less than expected, and -2 is much less than expected. From Kurasuk et al., 1968 and 2009. Susan's scale for MAP classes may look something like this. +2 is completion and implementation of 3 new skills. +1 is completion and implementation of 1 to 2 new skills. 0 is simply completing the training. -1 is missing 2 or more sessions, and -2 is when she does not finish the program at all. Case Plan Action Item 2. Mental Health Counseling. Mental health counseling. Susan needs to locate, schedule, and attend mental health counseling sessions to address her new role, work, and life balance. For cultural considerations, Susan would like a faith-based counselor. She would like to make sure she incorporates scripture and family beliefs into her sessions. Therapy should include cognitive behavioral therapy and acceptance and commitment therapy. Cognitive behavioral therapy, or CBT, works well for anxiety disorders and changing negative thoughts and behaviors. From Mayo Clinic, 2025. Acceptance and commitment therapy works well with accepting stronger emotions while connecting them to value-based actions. Cleveland Clinic, 2025. SMART goal for counseling. Specific. Susan will schedule her counseling intake within 3 weeks. She will follow all counselor recommendations. Measurable. Susan will sign a consent for release so that social worker can communicate with counselor. Susan will also utilize a self-reporting log to track her growth. Attainable. Susan will attend counseling sessions every 2 to 3 weeks per therapist recommendation and in the evenings or weekends to accommodate her schedule. Relevant. Counseling will aid Susan in healthy coping skills, balancing work, life, and her new caregiver roles. Time-based. Susan will complete an intake and her first session within 4 weeks. In regards to measurable objectives, Susan's counselor may utilize something like an acceptance and action questionnaire with her. It has a 1 to 7 scale, looking at 1 being never true to 7 being always true, with various statements, things such as, I worry about being unable to control my worries and feelings, to emotions cause problems in my life. Case Plan Action Item 3, Nurturing Parenting Program. Nurturing Parenting Program. Susan is to participate in the Nurturing Parenting Program for parents and adolescents because she is a new caregiver to her nieces and does not have children of her own. NPP was chosen for her case plan because it is an evidence-based psychoeducational program that has positive impacts in family functioning, parenting beliefs, and healthier and non-abusive parenting strategies from Family Development Resources. Susan should focus on discipline, family rules, and communication when it comes to her nieces. There is additional cultural NPP curricula if Susan wants to include those considerations into her learning. SMART goal for Nurturing Parenting Program. Specific. Susan is to complete the NPP Parents and Adolescents curriculum. Measurable. Susan is to increase in at least 3 of the 5 constructs that NPP focuses on, which are expectations of children, empathy, discipline, family roles, and power and independence, via the Adult and Adolescent Parenting Inventory Assessment. Attainable. Susan is to have no more than 3 combined no-shows or late cancellations during her participation. Relevant. Susan is to focus on communication and discipline, among other things, in her new caregiver role. Time-based. NPP is a 13-session program meeting once a week for 1 to 1.5 hours. For measurable objectives, nurturing parenting programs utilize an adult and adolescent parenting inventory. Shown here on the screen is an example of what Susan's scores may look like. On the left, A through E represents the 5 constructs that all nurturing parenting programs focus on. They are broken up into a 1 to 10 scale, with 1 being high risk and 10 being low risk for child maltreatment. For these particular scores, expectations of children is at a 6, empathy is at a 2, discipline a 1, family roles a 2, and power and independence a 3. 4 of the 5 scores are in the high risk for maltreatment category. Nurturing parenting facilitators will typically use the bottom 3 scores and put their focus there to help build the parent up to where they need to be, ideally in the end in the 7 to 10 area. These assessments are completed at the beginning and the end of the program in order to show growth. Application of intervention strategies. Social work theories utilized. Trauma-informed care theory, a strengths-based framework that shifts the mindset of what's wrong with you to what's happened to you, from the American Academy of Pediatrics. MAP classes fit here due to teaching prospective foster parents about the impact of child maltreatment on children and how to better provide safety and care for them. Social learning theory, the idea that observation and modeling can change behaviors, from UC Berkeley. Nurturing parenting programs and mental health counseling fall into this theory because Susan will be able to learn new ways to care for herself and her nieces. Cognitive behavioral theory. This is goal-oriented therapy used to change unhealthy patterns of thinking, from the Cleveland Clinic. This can help with anxiety and stress, which is what Susan is experiencing in her new role. Mental health counseling falls into this theory. System considerations. When looking at the various system levels, micro, meso, and macro, here's where Susan could fall in each. Micro, Susan is working to obtain guardianship of her nieces. Susan has her role in the CPS case and direct family intervention. Meso, Susan will co-parent with the biological parents of her nieces. This will better support the girls' well-being and family stability. And macro level, agency policy changes to better encourage and facilitate kinship-based guardianships. Final thoughts. By implementing the action items in her case plan, Susan will now be better equipped to care for her nieces and maintain healthy coping skills for her new role while juggling her current work and life. The interventions suggested, along with the measurable outcomes for accountability, will aid in making positive, long-lasting changes within the family. References include the Adoption and Foster Care page through Union County Human Services, the American Academy of Pediatrics, What is Trauma-Informed Care, the Cleveland Clinic for Acceptance and Commitment Therapy, as well as Cognitive Behavioral Therapy, Day, The Ultimate Guide to SMART Goals from Forbes Advisor, Family Development Resources for Nurturing Parenting Programs. References continued. Karasuk Turner Stokes for the Goal Attainment Scale, Mayo Foundation for Cognitive Behavioral Therapy, Social Work Portal for the micro, meso, and macro social work levels, Social Workers Toolbox for the Acceptance and Action Questionnaire, and the University of California, Berkeley for How Social Learning Theory Works. Thank you for listening.